How does the Mirena coil help to reverse endometrial cancer? It doesn't. You don't reverse endometrial cancer. But if someone has a uterus, a womb, they've never had a hysterectomy, and then they are put on HRT, whether that's through the gels, the tablets, the patches, they should never be given systemic estrogen by itself, because it can lead to an increase in the risk of endometrial cancer. We call that unopposed estrogen. That is only appropriate if someone has had a hysterectomy before, so they don't have a womb, they don't have a uterus, which means that they don't have an endometrium, and therefore there's no risk of endometrial cancer. However, when someone does have a womb and they need HRT, if we're giving them a patch, we can have the progesterone element of it within that patch. If they have a pump and they are rubbing that into their skin, then they can get the progesterone element from tablets or from a Mirena coil. Now, the Mirena coil helps to protect from endometrial cancer because it has progesterone in it, but that progesterone only acts locally. So you usually don't get the systemic side effects of progesterone when you're using a Mirena coil. And by systemic side effects, I mean things like breast tenderness, weight gain, acne, mood fluctuations and disturbances. But remember, it's the estrogen predominantly that is treating the symptoms of the menopause, but we need to negate some of the risks that it can cause by giving progesterone with it. A massive caveat to what I've said is that if you have vaginal dryness or what we call urogenital atrophy, so that's when the structures down below start wasting, then you can use estrogen creams and pessaries specifically for that indication down below without needing a progesterone element, because that type of treatment would not be deemed systemic, it would be deemed topical and local, so should not increase the risk of something like endometrial cancer.